Hello, everybody, and welcome to 12 Days, 12 System series. In the last day, we covered about the pulmonary system, whereby we discussed about the different pathophysiology, anatomy, about the different radiological markers, treatment, therapeutics of the lungs. Today, we are going to discuss with respect to the renal or the urinary system. So, whenever you talk about the process of filtration to function, a comprehensive review is what you're going to get in this video. So we all know that in our renal system, we have kidneys consisting of nephron as the main unit, functional unit, right, which is important for the glomerular filtration. You'll having ureters, urethra, and urinary bladder. So the anatomy is very simple. The kidneys are bean shaped. To them are connected two tube-like structure called ureters, which then embed into the urinary bladder that acts as a storage. And whenever there is 700, 800 ml of water that is in your bladder, you feel the urge to urinate, right? And mostly adults or geriatrics more than 70 years face urinary incontinency, right? So in these patients, we give oxybutynin, darafenacin, bethanacol like agents. And finally, an exit of urethra. So this renal, this nephron has a different microphysiology and morphology. So it has renal artery, renal veins. There is a medulla. There's a cortex. So this is a nephron consisting of glomerulus, a PCT, proximal convoluted tubule, the Henle's loop where there's concentration, distal convoluted tubule, and collecting duct. So you have a lot of diuretics that are given in hypertensive condition or kidney stones cystitis, so that the stones get dissolved and removed from the urethra. So over here, the different diuretics act, like the carbonic anhydrase inhibitors acts on the PCT, thiazide acts on the DCT, loop diuretics acts on the Henle's loop, right? So the normal GFR of any patient is 100 to 120 ml per minute. As it falls down, there could be chances of AKI, acute kidney injury, CKF, chronic kidney failure, or some of the other renal manifestation like the renal edema, renal fibrosis, or the chronic kidney diseases, right? So blood is filtered purely by the hydrostatic pressure. So there's a complete hydrostatic pressure which is involved in filtration of the blood. And the steps of urine formation involves ultrafiltration, tubular secretion, and selective reabsorption. These are the three steps of the urine formation. So beyond waste, kidney is not just a filter. It is also responsible for your bone health. Ask me how. Here it's just written bone health. So in the kidney, vitamin D is activated. Yes, in the form of D3 calcitriol or 1,25 dihydroxycholecalciferol. Number two, kidneys release erythropoietin. Erythropoietin is responsible for the stimulation of the bone marrow to produce RBCs. Thus, so there is no anemia. Many times we see that people are suffering from hemolytic anemia or some concomitant disorders. The third is the RAS system, renin angiotensin aldosterone system. And also kidneys are responsible for the homeostasis. There are different homeostasis like the water electrolyte, but kidneys are responsible for the acid base homeostasis, right, via excretion of hydrogen and reabsorption of bicarbonate ions. So there are a lot of times there are obstruction. There is pre-renal, renal, post-renal obstruction. Post-renal means the urethra specifically has a blockage of the outflow, either because there is prostate glands which are enlarged in men, or because of some stones, nephrolithiasis, ureterolithiasis, urolithiasis, right? Or there is streptococcal glomerular nephritis like infections or toxins, right? Or there could be some heart failure and hypovolemic shock. So acute kidney injury is observed by the kidney function tests. The most common tests are testing the creatinine, the urine output, the pH, color, and odor of urine. You know, the people who are suffering from diabetes, they have a sweet or a foul or a ester-like odor of urine, right? Because of diabetic ketoacidosis. Also, you check presence of abnormal substances. That's called urine dipstick test. Protein in urine, proteinuria. Ketone bodies in urine, ketonuria. Blood in urine, hematuria. Glucose in urine, glycosuria. Right? So kidneys are, and you know, many times when your renal and your hepatic system are not functioning well, dose needs to be tapered down. We taper down the dose, we decrease the dose in order so that because kidney से ही तो main elimination होता है, right? A drug undergoes absorption, disposition, thereby distribution and elimination. followed by metabolism and excretion. So, if the kidneys and liver are not able to metabolize and eliminate the drug, it will precipitate in the body and predispose, right, leading to a lot of toxic manifestation. So, the glomerular have two types of pathologies. One is the nephrotic syndrome, in which there is leaky filter. That means there's massive protein loss leading to hyperalbuminuria. In the nephritic syndrome, there is inflamed filters. So there is inflammation followed by oliguria, that is reduced output. In diabetes, it is exactly opposite, polyuria, excessive urine output, right? And then we are going to talk about the UTIs, where the urinary tract infection occurs. So mostly we give sulfamethoxazole, ceftriaxone, nitrofurantoin, right? Ciprofloxacin, like agents for managing the kidney conditions. Specifically, we first give them the urine culture test. That is very, very important. Or if in excessive cases, urine dialysis, lithotripsy, like procedures need to be adopted. You can also go out for checking the ultrasounds, because just like yesterday we spoke about pulmonary function test, we spoke about the chest x-ray, right, the ultrasound, the bowel fluid, the lung bronchoscopy. So similarly, sigmoidoscopy, colonoscopy, there are a lot of procedures by which you estimate the function and the wellness of a particular organ of your body. All right, so the diagnostic toolkits involve the bedside as well as the non-bedside. Bedside means something that can be just done within like point of care testing. So urine analysis, and urine analysis may mostly the infection, indicating the pus cells, proteins, blood, right? Or you can do the blood test, in which you measure the urea, electrolytes, and creatinine. You can also do radiological imaging, like you can perform ultrasound, CD scans, and one of the invasive method, like yesterday we saw the lung biopsy. Today, there could be renal biopsy, where a small tissue is excised. There's a small incision placed, and you excise a small tissue, and then perform the analysis, right? For like ascitic fluid, similar to ascites. So you observe whether the urine color is frothy, blood, dark, excessive yellow, indicating jaundice. Are there any on toxins like NSAIDs or some dyes? You check the swelling, edema. Edema is also another thing that you check, and the pain. Are you experiencing pain while you're urinating? That's the first sign of kidney infection, of UTIs, right? So the renal therapeutics, I already mentioned a lot of agents to you, like ACE inhibitors, angiotensin receptor blockers, diuretics, sodium citrate and all as an alkalinizer. So the end stage management, suppose sir the kidneys, the GFR is below 20 ml per minute, the kidneys have stopped functioning. So the only thing that you can be done is transplant. Renal transplant is a gold standard, followed by the immunosuppressants, because a new organ is being added to your body, so adaptation requires a particular time. Or you can do the peritoneal filtration, or the hemodialysis, right, via the extracorporeal filtration procedures. So over here we have covered about a lot of anatomy, physiology, pathophysiology, and therapeutics that is involved in the renal system. So in this one day, one disease series, we'll be bringing 12 days, 12 series of 10 minutes each, whereby in this 10 minutes I'll be giving you a nutshell idea of what every organ is. Because irrespective we belong to pharmacy, nursing, or we belong to the healthcare field, allied fields, physiotherapy, dentistry, anatomy, physiology, and pathophysiology is something that we all study, right? Whether it is Ross and Wilson, Tortora, Sembolingam, D.D. Chaurasia, any book of anatomy you pick up, people will be studying all of this for sure, right? So, thank you so much, everybody, for your kind time. And I hope that this series is really helping you. Do comment down if you want me to bring any other video on any other particular topic. I'll be more than happy to welcome your suggestions. Have a great day. And thank you so much, everybody.